A new recommendation for women in their 40s could save nearly 20% more lives. The rate of metastatic breast cancer in women 25 to 39 is up 32% since 2009. And now the U.S. Preventive Services Task Force is recommending most women should get mammograms starting at the age of 40 every other year. So joining me to talk about this change, local obstetrician and gynecologist, Dr. Chandra Adams with Full Circle Women's Care. Thank you for joining us this morning.
Thank you for having me.
You know, Dr. Adams, in 2009, the same group advised against mammograms for women in their 40s, encouraging them to make, quote, an individual decision. So why are we seeing this change now?
Well, because we're seeing more cancers now. The rates of cancers have been rising by 2% every year since 2015. And we all know that early detection is most important to our best chance at a cure.
You know, this can get a bit confusing, as you just talked about, because there are different recommendations. For example, the American Cancer Society says women have the option to get a mammogram at 40 to 44, but recommend women get screened at 45 to 54. And their recommendation also is every year instead of every other year. So what do you tell your patients and why?
So the American College of Obstetricians and Gynecologists agrees with the American Cancer Society, the American College of Radiology, with regard to starting at age 40. The obstetricians and gynecologists typically will recommend annual screening as well, in addition to clinical breast exams. So typically the schedule that I try to tell my patients to look for is to come in for your annual exam. So you're getting clinically screened in the office, mammogram 6 months later, back to clinical breast exam 6 months later. That way, every 6 months, someone is taking a look in a clinical setting.
And you know, you pointed out that many of your patients who have been diagnosed with cancer, it's a year after they've had that mammogram. So it isn't this every other year. That's a safe kind of space where they should get checked.
Exactly. We know that the biggest risk factor for breast cancer is age. And the more space you put between the breast cancers as women age, the higher their risk is. All the breast cancers that I've unfortunately had to diagnose had normal screenings just 1 year prior.
All right, let's talk more about the task force. They also found that Black women are more likely to die of breast cancer and develop breast cancer younger, saying that more research needs to be done to understand and address the death rate among Black women. So what does that look like as far as the studying, and what should this population do in the meantime?
So anyone who has increased breast density, and that is something that we see at higher rates in the African American community, is at increased risk for missed detection. And if they have a score for a lifetime risk greater than 20%, then that with the addition of breast density, their insurance may qualify them to get MRIs, an additional screening tool that's able to detect at even higher rates than your regular screening mammographies.
All right, so with this new recommendation, I guess it's kind of a mixed bag. A good thing that now they're saying 40, but again, you're recommending against that every other year.
Absolutely.
All right, so every year starting at the age of 40. Is there ever a time when you would say every other year? Because I've seen some that say after the age 55 that it's okay to do every other year. What do you say for that population?
Again, with your highest risk factor being age, after 55 is definitely when you need to be going to every year.
All right, good information for women. Definitely talk with your doctor, because being proactive can certainly catch a cancer, detect it earlier, and get the proper treatment so you can have a long and healthy life. Dr. Adams, thank you so much for joining us today.
Thank you.